it's a lot easier to get somebody to come to a class that talks about slowing down the aging process than improving posture. So this is the importance and assessment of posture, and I do this because, and after this class, you're going to understand why this is so important. So if we look at what we're going to do tonight, we're going to talk about what we know about posture scientifically, why it's important. I'm going to show you how to assess posture, and if it's okay, I'm going to use you as a guinea pig. Is that all right?
Yeah, sure, no problem.
Okay. And we're going to practice what we know to share with our families. So if we look at structure determines function, and they're very closely related. So I mean, this is a dumb question, but which one of these is going to work the best?
Square.
The square. Okay, great answer. Maybe for some, but the round one, obviously. So the way something is structured determines its function. So I want to ask you guys a question. If we look at sort of when you go into a physician and you're going in maybe for the first time and he's going to check you out, what are some of the things? Hi, come on in. Have a seat. What are some of the things that your physician is going to look at when he's trying to determine how healthy you are? What's the first thing he's going to do?
See how well you move.
I've never been to a doctor that did that. Okay.
He's gonna.
You go into a medical doctor.
He's
okay.
gonna take your blood pressure.
Blood pressure.
And your pulse.
Blood pressure, pulse, maybe temperature. How about oxygenation? You know, a little pulse oximeter. And why does he do that? Why does he do that? Why does he take your blood pressure, for example?
What's going on internally.
Okay. And because he knows that there are standards for blood pressure. There's a healthy standard and there's a standard that's unhealthy. Now, unfortunately, and I'll just throw this in there, no extra charge for that, but the pharmaceutical industry is determining a lot more what those standards are rather than what's actually healthy. Because like 25 years ago, the standard for blood pressure for the top number used to be 100 plus your age. I don't know if you remember that or not. So 100 plus your age. It's not anymore, okay? When I first came out of college and I worked in a lab in St. Joseph's Hospital in Omaha, you know, the upper normal number for cholesterol used to be 350.
Really?
Yeah, 350. And so and I don't think it should be that high now, by the way. But the pharmaceutical industry has gradually lowered those numbers, and the reason is they want you to take more of their medication, which doesn't heal you and get you better. It just manages your symptoms or your risk factors most of the time. So we know that there are certain parameters for blood pressure, for temperature, for pulse, for oxygenation. But how many of you ever gone into a physician and he looked at your posture? You know, we need to look at your posture and see. Anybody? I've never seen it. Okay. So, you know, if you walk into a physician with a left high shoulder and a left head translation like this, I don't even think he'd comment on it. Okay. But do you think this would affect your health? Yeah. You know, I have a next door neighbor. I've never been able to talk to him about this, but he walks like this. I really like the guy. I like his dog too. He walks his dog and he walks like this. His feet are out like this. Do you think it takes more energy for somebody to walk like that? It takes a heck of a lot more energy than if they're going to walk straight. So posture does matter. So this is what I was just talking about. So there are published ideal and normal ranges of posture. These have been rigorously studied and published in top shelf journals. The one for the cervical spine was published in 1996, lumbar spine 1998, thoracic spine in 2003. surgeons use this model of the cervical spine that was published to determine how they're going to fuse a neck. Okay? Because I'll tell you something, before that was published, and I still see it, by the way, I still see necks that are fused backwards. You know, that's not very good for the patient. So you have to, if you're going to fuse somebody's neck, it has to be at a normal C curve. I have a patient right now, she's my age, she had her neck fused years ago and they fused it backwards. Can't do anything about it now.
Why did they do that? Weren't they?
Because they're idiots. You know, I mean, that sounds rude, but it's just stupid. Okay? And these articles, these standards were actually were researched and published by a chiropractor who's also a mathematician. It's a guy by the name of Don Harrison. He has a PhD in math, but he's a chiropractor. And so he published those studies. So now surgeons, if they pay attention to this, will fuse the neck in a normal C curve. It's a heck of a lot better for the patient, okay? Now, normal spine is a healthy central nervous system. Abnormal spine, unhealthy central nervous system. So this is what normal should look like right here, okay? So normal cervicals, normal spine. This is abnormal. First of all, you see how far forward the head is? Got a big thoracic kyphosis right here. Lumbar spine, not too bad. Thoracic kyphosis, and the head is way in front of the body right there. So that's what we say abnormal. We know your central nervous system controls the body. The spine protects and informs the central nervous system. So your spine is constantly feeding information into the central nervous system and vice versa. So why is an abnormal posture unhealthy? So here'd be a very abnormal posture, and I see people that come into my office that are similar to that because it hastens this. It hastens sickness and disease and ill health. So here's an interesting study in psychology today when they were talking about posture and body language. This is in 2020. Body orientation and openness. It's no secret that a closed off body posture appears uninviting and can say, I'm not interested. Facing the other person invites connection. An open posture conveys trust and makes it easier to be approached. Abnormal posture, you have more pain. So let's everybody do this exercise. A normal neck should look like this. Okay, curve your finger. Be a nice C curve. So it supports the weight of your head, just like this. Now, do this. This is a reversed curve, okay? A lot of my patients have this. See what that does to your, now if you just did this to your finger for 2 or 3 weeks and you didn't stop, what do you think would happen to the joints in your finger? Just did this for 2 or 3 weeks, just like this.
Get compressed.
They get compressed, they start getting arthritic, okay? You start developing arthritis in these joints. These joints aren't designed for this. They're designed for this, okay? So what about, I want you to do this. Slouch like this and breathe in. See how easy it is.
Takes more effort.
Yeah, now come back up like this, breathe in. Isn't that a lot easier? Yeah. Okay, so posture affects the amount of air that we can bring into our body, the amount of oxygen we can bring in. So what do you think that does to our energy? If you don't have enough oxygen, do you think it'll lower energy or upper energy? Raise your lower it. So if you have a posture that's like this, and you can't breathe in oxygen like you could if like this, that could contribute to chronic fatigue, chronic tiredness, because you just can't get enough oxygen. So posture really matters in terms of health. Abnormal posture, you have less brain. The average pain-free person above 45 years of age tends to lose about 0.5 square centimeters of gray matter per year. The average chronic pain patient can lose as much as 10 to 20 square centimeters of gray matter a year, which is a lot. You know, anytime you have a reduced cervical lordosis and it stretched the vertebral arteries, that reduces blood flow to the brain. So when you have a nice C curve, the arteries in your neck flow right along that curve. When you lose that curve and it stretches those arteries, what do you think happens to the internal volume of those arteries when you stretch them?
Constricted.
Yeah, they get constricted. You lose blood flow to your brain. That's another great piece of chiropractic research. So, abnormal posture, here's another piece of research. You're less coordinated and balanced. People with forward head posture, out here like this, can't track things with their eyes as well, can't return their heads to neutral as well, cannot get back to center and balanced as well. And these people tend to fall more, okay? So that's why I constantly hound my patients about laying on their Denerol or laying across, having their head lay across the end of the bed, because it's going to help their quality of life. I mean, as we get older, one of the things we do not want to do is fall, because you know that can cause a lot of issues. So posture can help balance. Now, I can't tell you how many people that I check balance in every new patient. Some people do pretty well. You know, they can do this for a while and they're pretty good. But some people lift their leg and they fall over immediately, okay? You ought to be able to do this for about 25 seconds, okay, on each leg, okay? And so if you can't, if you have a balance issue, that could be due to posture. Now, abnormal posture, when your sympathetic nervous system is on fire too much, or when it's not appropriate, you're in what's called hypersympatheticonia, which is not good. Okay, so this is fight or flight. So anybody ever been really scared, had a real scare? Mm-hmm. What happens to your body? You can feel things change pretty fast, can't you? Okay, so people that are in that state all the time, do you think they heal? No. Your body cannot heal in that state. It heals in a parasympathetic state. So reducing forward head posture actually pulls your body into more of a parasympathetic state so it can heal easier. Abnormal posture, your spine breaks down faster. The kyphotic neck, which is like this, reverse curve, breaks down 200 to 300 times faster than a normal neck. That's a lot, okay? When I say break down, you develop arthritic joints 200 to 300 times faster. So let's see. Abnormal posture creates pathological tension in your central nervous system. Central nervous systems are not, your central nervous system messages are not just neurochemical. They're literally propagated like sonar waves, okay? When your spinal cord is stretched, that can't happen nearly as efficiently, okay? So, with abnormal posture, your organs suffer. So, not only do your nerves not transmit messages to organs as well, but think about this. If you see somebody that sits like this all the time, okay, what do you think's happening to their internal organs?
Compressed.
They're being compressed, okay? Do you think our organs work as well when they're compressed? They don't, okay? They can't, okay? So posture not only affects the nerve supply to the organs, but it literally will compress the organs over time. So slouching in your chair, and listen, we've all done it. You know, I've done it, you know, and And I teach this stuff, and I still do it occasionally. But it's not good for you, okay? Slouching crowds your organs and causes them not to work as well. So this is the consequences of degeneration in your spine over time. Muscle degenerates, and it doesn't grow back quite as well. So what does loss of cervical curve do to the speed at which your central nervous system processes? So we all know this. Would you agree that we have messages that go from the brain to the body to the brain, okay? We know, and you've heard me say this before, you cut off the head, you die instantly, because we need that nerve energy, okay? So, but what happens if the spinal cord between the brain and the body is stretched? In other words, you don't have this, you have this, or you have that. Okay, the spinal cord is designed to look like this, not like that. So what happens if you stretch the spinal cord?
It's not like a rubber band.
Yeah, you're right. That's a good observation. Not like a rubber band, okay? So it slows the processing time from the brain to the body. Okay, slows that. Now, do you think, this, by the way, this was published in a journal called Scientific Reports. It's one of the hardest journals to get into in the world. I think it's like the 6th hardest journal to be published in. It's in the journal, the Nature Journal Group, which is a really high-level scientific journal. But, and this is 2022, so it's a pretty recent study. And this study, by the way, was researched and published by a chiropractor. So think about this. What do you think the NFL would do if they got a hold of this? Because don't you think they want their players to have normal cervical curves? Because it would increase the processing from the brain to the body to the hands. Okay, so this has a lot of implications for sports. And the person that did this study, he's publishing another study where he took all the things that they look at in the NFL Combine, and he looked at people with abnormal cervical curves and normal cervical curves, and looked at how high they could jump, what their hand-eye coordination is. That study is going to be published pretty soon, okay? What else happens with loss of cervical curve and altered head posture? It affects your lower back, okay? So head and neck alignment affect lower back pain. So you've all seen that illustration I do with a bowling ball. So if you have a bowling ball and you hold it close to your chest, you know, you can walk around with that for a while. What if you hold it out here and just hold it? What's that going to do to your lower back? Well, when your head is out here and you're constantly, you're trying to hold your head up, that can affect lower back pain. Abnormal posture, cervical posture increases stress on the entire spinal cord and nerve roots. Abnormal posture in any part of the spinal column will reduce abnormal stresses in the produce abnormal stresses in the entire cord and nerve roots, where normal posture will minimize these stresses. So this is a kyphotic posture right here. This is normal. This is kyphotic. You see people like this walking around all the time. Okay? So kyphotic posture this is another interesting study. Is associated with loss of independence and actual mortality in community-dwelling older adults, which most of us here are. Deleterious effects of kyphotic posture include decline in physical function, impairment in pulmonary function, which you can understand that because if you're like this, you're not going to breathe as well. Increased pain, gastroesophageal reflux, poor quality of life, and increase in falls. So if somebody's walking around a lot like this, can you see how they would fall easier than if they're walking straight? Okay, so if we could get people just like in nursing homes and in assisted living homes to work on their posture, we could probably increase their quality of life quite a bit. So how does technology affect our spines? Well, there's a new word called text neck that actually describes people that look at their phones and tablets all day. It says the improper use of personal computers and especially cell phones might be related to the development of a complex cluster of clinical symptoms defined as text neck syndrome. Children and adolescents, and I just flew back from California the other day, and I was sitting across from a mother and she had about I guess her daughter was probably about 7. The entire way, 7-year-old was looking at her tablet like this, Lots of kids do that. Now, the text neck syndrome has increased stresses on the cervical spine, which can lead to cervical degeneration, along with other developmental, medical, psychological, and social complications. That's right out of a journal article. Complications of text neck syndrome can involve the eyes, heart and lungs, the head, and the mental health field. These postures result in the long-term damage to the body, including taking years off of their life expectancy. So it's becoming a problem. And I'm not saying that kids should never look at a phone or a tablet, but they need to be taught the importance of posture. Because when I was in high school, the only thing we looked down at was a typewriter. That's all we had. Yeah.
Can you explain how that affects the eyes? What does it do to the eyes?
Well, first of all, when you have your head forward like this and you're pulling on your spinal cord, you're affecting the cranial nerves, and one of those goes to your eyes. But you're also changing your depth perception. So if you're just looking at something like this compared to like this, that's going to change the way your eyes focus over time. So it can change it. And how many kids nowadays do you see with glasses that have to wear glasses? Lots of them. Okay. Now, when I was in school, high school, college, there were people that had to wear glasses, but not nearly as many kids as there are now. Here's another study: abnormal posture affects longevity. A diagnosis of low back pain in the previous year was correlated with an 11% increase in mortality in the current year. Getting adjusted and correcting your posture lengthens your telomeres. We talked about that a couple of weeks ago when I talked about anti-aging. It slows down the aging process. So when assessing a person's posture, it's a little bit like a blood pressure screening. We're going to look at, okay, somebody's posture is bad, so what can we do to change it? And that's where I come in, and that's where chiropractic comes in. So let's talk about how do we analyze posture. Now I want you to come up. Okay, so let's come on up and let's just look at how we do that. Okay.
I have a lot of layers because I rode my bike here.
That's okay. It's okay. You want to take your hat off?
Hat?
Hat, yeah.
If you like.
Yeah, that'd be great. Okay. So, first of all, we're just gonna, I just want you to look straight ahead, okay? Close your eyes. Put your chin on your chest. Now head back and back to normal. Okay. Okay, you can open your eyes. Now just relax, okay? Just relax. Okay, look straight ahead. Okay, so first thing we're gonna do is we're gonna look at his feet. Just look straight, okay? Okay, we'll let you know what's going on, all right? So you notice his feet are turned out.
Both of them.
Yeah, both of them, yeah. Now, I want you to just relax. There you go. Okay, look at his hands. No, don't you look at them. Do you see how they're different? This hand, let's see.
little bit. One's more flat, and the other one's kind of like that.
Yes, and this hand is flaring out a little bit more. So let's look at his shoulders. Let's look at it from behind here. Shoulders are pretty level. And let's look at head and neck. Actually, your left ear is a little high, but your neck is pretty straight, okay? Now, another thing we want to do is we want to look at translation. So, I don't think he really has much translation, but, you know, if his hips are here and his upper body's leaning this way, that would be a left translation. And we want to look at rotation. So, we take our fingers and we look at his shoulders, and I would say that his upper body is rotated clockwise just a little bit, okay? So, shoulders are pretty even.
I constantly have to push my shoulders back. I adjust my shoulders all day long.
Okay, well, at least you're aware of it.
I'm very aware. Yeah.
That's good. And sometimes as they stand here, certain things will come out, things will develop that you can see. Now his left shoulder's a little high. I would say that most of your problems with posture, a lot of them are like lower back and lower with your pelvic area. Your feet are turned out. You know, let's look at you from the side. Now, when we look at somebody from the side, one of the things that I do is I want to see how well, I want to bisect the ears and find out, is the head sitting on the shoulder, across the shoulders the way it should? He's not bad, not too bad, okay? A lot of times I see people with their head way out like this, and you bisect the ear and it's way down in front of the shoulders, but he's not bad. His ears are sitting pretty square on his shoulders. So I would say that your posture certainly isn't perfect, but it's not the worst that I've ever seen either.
Okay.
Okay? Good. Anybody have any questions about it? You can go ahead and sit down. Thanks.
Thanks.
Appreciate you doing that. Anybody else want me to look at their posture? Okay. Nobody else wants to get up in front and
We
embarrass
don't want to be
themselves.
dissected.
Yeah, okay. I get it.
I'm happy I got called on.
I'm sure we
got
probably all
something
have
from
some
that.
issues though.
So here would be an example of somebody with postural issues. Forward head carriage, left head translation, high shoulder, classic example of bad posture. So you start from the feet and you go up. You start from the front, then the back, then the side. You compare one region to the other. It's not rocket science to evaluate posture. You can learn that pretty easily. So, any questions? Does anybody have any friends or relatives that have really bad posture that you can think of? They might want to be evaluated and just see what's going on. Because posture, like blood pressure, really can affect your health. High blood pressure, you might have some issues. Bad posture, you're going to have some issues. And we need to do more of those tests. Anybody have any questions?
So you said on my, you imagined that I had, or felt that I had problems in my lower back. Actually, I don't have lower back problems. My problems really hurt me in my middle back.
Okay. So
Right in the middle. In the top, it's fine. In the lower back, it's fine. But in the middle, I have lots of, probably 3 vertebrae. I feel pain in it. That's why I constantly have to, I push my neck back and I have to stretch it. And I feel it when I do yoga or Pilates. That's so like at the end, that's when I really kind of stretch it out and I kind of readjust myself.
well, where you have
But I feel it in the middle.
yeah, where
for
you have
sure.
the pain and where you have the problem may be completely different.
Yeah, yeah,
You know,
Yeah.
I was just assessing posture,
right.
and your upper body was not too bad. But your lower body, you had some issues there. You know, your feet are turned out, so that tells me you have some pelvic structure issues. And you may not have any pain in your lower back. Just because you don't have pain somewhere doesn't mean you don't have a problem there. I mean, how many people are diagnosed with cancer and have no pain? Lots of people. Pain is not, I'm not saying pain's not important, but it's not, it doesn't tell you whether you're healthy or not. For sure, okay? So.
Well, I feel it when I do stretches, like when I do twist stretches, like when I'm laying on my back and I turn my shoulders this way and my legs that way, I can feel it pulling on one hip especially.
Yeah.
So that's probably what you're talking about, because I feel it. And I stretch like that every day, just multiple times a day. And I constantly have to like readjust myself all day long.
And it's good that you do that you stretch like that.
Multiple times.
But you probably have some other issues going on that
Yeah,
need
well,
to be looked at.
I went to a chiropractor for 2 years when I was a child, between 8 and 10 years old, because I got hit by a car, and it put a curvature in my spine an inch big, just from that accident. I was knocked out. It was my first concussion, and so I learned, And after 2 years, he said I was fine. But I mean, that was like how many years ago? 40 years ago. So I mean, I'm sure many things could have came back over time.
Yeah.
Because your body's constantly changing as you get older.
Yeah, and as we develop habits and things like that.
Yeah, sure.
Good. Yes.
Can you address mattresses when you buy one? Should you go for the firm or the medium, and how much do mattresses affect a person's bones?
I think mattresses affect a person when they're really too soft and they sag. Okay. I would say this. I always tell people medium firm. I mean, you have to sleep on a 2x4, nobody wants to do that. But I think you need a fairly firm mattress. And I've never slept on a sagging mattress that didn't hurt my back, and that's the main thing that I look at. If the mattress sags, you probably need a new one, and that is going to affect your back over time. It'll affect your spine. So, something medium firm, lay on it, whatever, if it's comfortable for you, then so it should be okay.
You had mentioned how you recommend how older people they should put their head off the back of the mattress and just let their head hang. I suppose
Depends on depends what I see in the X-ray. Okay?
Okay.
For some people, that's really good, but for some people, I wouldn't do it. There's some people I would tell them not to do that. Some people need a Denerol or a block to lay their head on. Depends on the structure of your neck. But one size does not fit all, I can guarantee you that.
What would be some common everyday things that could be done? For example, you just said like that would be a simple solution, but it would need consultation. But like what would be some just general?
Okay, here's a general thing you can do for your neck. Okay, this is an exercise, and somebody
exercise.
Actually, as was shown that this really works on X-ray. So you look up, bring your head up, down like you look up, bring it down, bring it back like this. Okay, that'll actually put the curve into your neck. Up, down, back, and that actually will put a curve in your neck. So you do that exercise regularly. That's a good one to do. Okay, that one, and then depending on what your X-rays look like, I can give much more specific exercise for home. Like I said, there's some people, that have a certain structure in their X-ray. I wouldn't advise at all that they lay their head off the end of a bed. It's not good for them. Okay, so it depends. Good question, great question actually, because I know some people that lend their Denerols out to their family members and say, "Hey, lay on this." Well, that isn't always a good idea, depending on what they have.
So a person who would do that, who it wouldn't be a good idea for, what kind of sensation would they? How could the sensation be described? Like, for example, when I do stretches, I like it when it hurts just a little bit, where there's just a little tension, and you hold it. You hold it for 30 seconds or 60 seconds, and then you release it. And just in general, I do that with even hamstrings or
Okay.
back or whatever. Any
So
muscle.
if you laid off the end of a bed, for example, and let your head hang, which can be a really good exercise for some people. But if you've got a certain configuration in your neck, which is called, the medical term for that is called retrolisthesis. I mean, you can actually cause some cord compression, and you might get numbness and tingling in your hands. You might get headaches. You know, you might get nauseated. You know, for some people, it's not good. Not good at all. Okay. And when I see that in an X-ray, you know, I'll definitely make allowances for what I tell them to do. So again, it depends.
I have a question about balance issues. What kind of exercises can a person do to
To help
better.
with balance. Okay, this is one I show all of my patients, okay? So I say you can get in between a door frame, or you can just get next to a piece of furniture. Lift one leg up, put your finger out, just try and hold it up there. And if you start, you know, tipping over, just put your finger out there. And you just do that on one leg for 90 to 120 seconds every day. You can switch legs and go back and forth. But if you just do that, you know, hold it up to where your leg is even with the floor like this. And then, you know, get between a doorpost and you fall over, just hold yourself up. That's a good balance. Now, another great balance exercise that I do, but I'm not going to tell you to do this because most people wouldn't want to do it, is I run up hills backwards. So I do it a lot. So I have this long hill by my house. I run up the hill backwards for balance. I'm the only one in the neighborhood that does that.
Probably.
Yeah. And so, and it does help. It really helps to do that. And the primary reason I do it is for balance. Now, it also works leg muscles way differently than running up forwards. I've noticed that. It's harder. It's a lot harder to run up backwards. But anything you can do like that is really going to help balance. I mean, you know, jumping rope is good for balance. So you can do that. I don't do that, but that's another thing you can do.
I'll bring some and we'll start doing double dutch here and there.
Okay, Carmen?
How do you go back down the hill then?
Walk?
You should walk first.
Yeah, I always walk. I never run downhill.
Roll. You don't roll.
No, I've never done that.
Not in the snow.
No, never done that. But I run up the hill as hard as I can, and then I walk down. I run up, walk down. Run up, walk down. So, yes.
So how long do you think it's gonna take before they figure out that all these kids that are knee deep into their phones and their computers and stuff that are really damaging them and do something about it? Or is there, I mean, who cares? Is that what's,
Well, they've already figured it out because it's being written up in journals.
but they don't talk about it? I mean, they don't warn kids.
No, they don't. They and you know, the thing is it takes about 10, sometimes a lot longer than that, 10 years from something to go from a journal into where it's common knowledge and practice. It takes a long time for that information to get out into the community at large. So, I mean, it may be, I mean, we're still dealing with, you know, vaccine damaged kids. And we've been talking about that for decades. And when is that going to stop? You know, and I talk about that in my vaccine talk. So some things are so politically sensitive that they may never happen, you know? And I don't know about this, but I know that the stuff that I showed you is right out of medical journals. It's direct quotes out of medical journals. And so it's out there, it's written, but it's getting it out into the communities. And, you know, I don't know how long it's going to take. It's a great question, you know, a really good question. I mean, look how long it's taken just to get chiropractic to be recognized as something that has a lot of value in our culture. It's taken decades and decades and decades for that. And so, I don't know when. it should be, you know, I mean, what should be and what is, there's a big gap in between that. You know, I mean, you know, we're just now getting it, and I'm gonna do a 10 minutes of truth on this. I don't know if I'm gonna do it tomorrow or not. We're just getting to the point now where lots of people are finally recognizing that the pharmaceutical industry lies. They lie about their research. You know, their books are being written about it now, about how a lot of these drugs, it's all a bunch of lies and fabrications. And so, and I'm not saying all drugs are like that, but a lot of them are. And so that's just now starting to get out that the pharmaceutical industry is not being honest, you know? But how many years did it take? Remember back in the early 2000s with Vioxx? Remember Vioxx? This huge drug. I mean, hugely popular drug. And they started doing some more research on it and found out that it was causing heart attacks, a lot of heart attacks. And the company, which I think it was Pfizer, was the one that had it. They had ignored that in their studies. They'd ignored the fact that it was increasing heart attacks. And they only wrote up the good stuff, and then when they started getting sued, a lot of that came out. You don't see Vioxx on the market anymore. It's causing heart attacks. Remember who is the famous skater that used to golly, very, very famous Olympic skater used to, she was in the Vioxx commercials. I wonder what she thinks about that now. I can't remember her name, but you'd know who she was. So, I mean, it just takes a long time sometimes for truth to come out. So, I don't know the answer to that question.
Are you familiar with him? Sure you must be. Yeah. Phil Donahue is affiliated with that one mailing. I would get it. You have to pay $10 a year or something. But the worst drugs. Do you?
I know who Phil Donahue is, but
do you know that the mailings that he is affiliated with? He talks about all different drugs, and they put in there ones that they're still on the market, but they're not good for you.
I'm not familiar with that. But there's plenty of them out there like that. Yeah. I would say Celebrex would be one of them, but yeah. So good. Well, it's a little late. You know, it's past time. So thank you for coming. We're going to do. What are we going to do? Thyroid. The next class I'm going to do is on dysfunctions of the thyroid. What makes the thyroid go haywire, and how you can fix it. Okay. So we're going to do that next time. And I'm seeing younger and younger and younger patients with autoimmune thyroid. It's unbelievable. So we'll talk about that next time. But thank you so much for coming tonight. And